I'm delighted to introduce Professor Sean Dinneen. So Sean is a consultant endocrinologist here in Galway, and he is the national lead for the PPI Ignite Network, the newly established PPI Ignite Network. Sean previously was the lead of the PPI Ignite program at NUI Galway, and he is here today to speak to us about Towards Excellence in Research in Ireland, the PPI Ignite Network. So he'll be giving us an overview of the PPI Ignite Network and maybe what we can expect to see over the next 5 years.
Good afternoon. My name is Sean Dinneen, and I'm going to present an update on an exciting development that has just started, the PPI Ignite Network. And I'm going to take you through in the next 15 minutes or so some of the exciting developments that are happening and that you can hopefully participate in over the next few years. The title slide refers to PPI not being an end in itself, but rather a means to an end, with the idea being that PPI contributes to excellence in research. I'm going to introduce you to some of the people and some of the organizations involved in the PPI Ignite Network, describe our ambition and our vision for the work that we're going to do, take you through some of that work, and then finish up with opportunities for you to get involved in this work. So I think it's appropriate to start by acknowledging the contribution of the HRB. The network that I will be telling you about is funded jointly by the Health Research Board, the Irish Research Council, and the local higher education institutions that are hosting the network sites. But really the HRB has led the way in this area in Ireland, and taken from their recently published strategy, they have the ambition to place the voice of the public, patients and carers at the core of everything they do. And the PPI Ignite Network will, I think, be an important part of the infrastructure for health and social care research in Ireland in the next few years. So the network sites are described on this slide. The 5 original Ignite sites that many of you will be familiar with, because we have been working together for the past 3 years. And those 5 sites have now been joined by UCC and RCSI to form the 7 lead sites in the network, in the new PPI Ignite Network. These are the site leads, and they come from different backgrounds with nursing, speech and language, medical device technology, genetics, genomics, epidemiology, sociology. And so this diversity, we hope, will lead to innovation in our approaches to delivering public and patient involvement in Ireland. As well as the lead sites, each of the universities also has a network of local partners. In this case, we're illustrating the UCC partners, but all of the local sites have, all of the lead sites have local partners, a total of 53 different partners working with the university locally to build capacity for high quality PPI in their own communities. A new development with the network is the introduction of 10 national partners, and we're very excited about this and the opportunity to work with organizations like Health Research Charities Ireland and IPOSI, who have really been part of the work that we've been doing during the Ignite phase, also coming on board to universities, Queen's, Belfast and Maynooth, organisations involved in delivering health and social care like HSE, Research and Development Office, and TUSLA, organisations involved in influencing policy in the higher education sector like Campus Engage and the Irish Universities Association, two successful existing networks in Ireland, Sphere, focused on population health services, research and education, and the Trials Methodology Research Network. And then one international partner, the International Collaboration for Participatory Health Research. So together with the lead sites, these national partners will work with us to really build on the success of the Ignite phase of our work and try and take it to the next level, influencing policy and practice around PPI nationally. We have a yet to be established public advisory panel that we envisage will be a very important part of the network and its functioning, an important part of the network governance. I'm using an image from our local PPI Ignite at NUI Galway public advisory panel, which I think has been a big part of the success of our own efforts in NUI Galway. And we hope to learn from this and form a national public advisory panel. So taking all of these elements then, we believe that the network has the potential and will become, for Ireland to become a world leader in PPI by promoting excellence and innovation, and harnessing the talent among our national partners, local partners, and the ambition of our funders and higher education institutions to achieve this culture change. So our PPI journey during the Ignite phase, we haven't finished the local efforts to build capacity and advocate for high quality PPI. That will continue, but there will be an expansion in terms of the new universities joining us, the national partners, and we hope further expansion as the network progresses. And then this innovation ambition as well, to think outside of the box and try to imagine new ways of promoting and delivering PPI in our research efforts. So the work packages that we have undertaken, the programs of work, if you will, are described in this slide, and I'm going to take you through them briefly in the next few slides. So work package 1 looks at building national PPI capacity, and this will be delivered by jointly by DCU, Veronica Lambert and Lucy Whiston, and NUI Galway, Ruth McMenamin, and one of our national partners, HRCI, represented here by Avril Kennan, the CEO. So the aim of work package 1 is to just build on the work of the Ignite phase and increase the capacity for PPI through training and education for researchers as well as patient organizations and members of the public, creating these participatory spaces for co-learning and tapping into the different perspectives of public patients and researchers working in collaboration. So an image from, I guess, from work package 1, the HRCI is an umbrella organization for many charities. IPOSI likewise brings together a lot of different patient-facing organizations, and I think these two partners in particular are really going to help us to tap into and hopefully build on what is an appetite and ambition for PPI in many parts of the health and social care system. Work Package 2 then is going to be co-led by UCC and UL. John Salzberg and Patricia Carney will be the leads. And the goal of Work Package 2 is to focus on the next generation of researchers and try to embed PPI and good attitudes towards PPI in their future work. So I like the phrase normalizing PPI into undergraduate and postgraduate teaching and learning, so that it's not looked on as something additional, but rather something that is part of how they view research endeavors. And so developing principles and resources to incorporate PPI into teaching and learning, developing shared learning outcomes across the network, and developing and delivering new modules at the undergraduate and postgraduate level, building on existing initiatives. And there's also an opportunity to establish awards for excellence in PPI. Work Package 3 involves embedding PPI nationally and locally through interrogating and influencing institutional policies and procedures. This work package will be led by Thilo Krall from UCD and Giampiero Cavalieri from RCSI. The three main focus areas will be looking at institutional policies and procedures, interacting with and influencing research ethics committees in terms of how they view PPI, and then looking at PPI in national policy. Work Package 4 is led by Trinity with input from the National Programme Office, Mary McCarran, Sarah Bowman and Michael Foley will be leading this work package, looking at promoting excellence through improving the quality of the network's PPI activities, developing a culture of impact assessment as a way of improving the PPI offering, and then creating this shared learning space among network partners. So some of the questions that that Work Package 4 and the Trinity team will be addressing are outlined here. How can we build a shared definition of what high quality PPI means? What are the issues that the PPI network can tackle together? And developing an impact framework is also part of the work package. So and finally then Work Package 5, the National Programme Office, myself and Edel Murphy, co-leading with national partners including Maynooth University around expansion and incorporating new members to the network, and TMRN, the Trials Methodology Research Network. So the work of the National Programme Office, or Work Package 5, will involve an online hub, which I'll tell you a little bit more about on the next slide. I've mentioned the public advisory panel already, the process for network membership important for the new technical universities and IoTs. Embedding EDI at the core of all network activities is a condition of our award, and an important aspect of our work that will be a focus early on in the network. And then supporting funding calls to look at methodology around PPI, measuring the impact of the network as opposed to the impact of PPI itself, and maintaining good governance for the network. And finally, outreach to international partners will be coordinated through the National Programme Office, but will happen across all of the lead sites. The online hub will be an important part of our sharing of resources and maintaining a calendar of PPI events, which have started already As some of you are aware, DCU and the National Programme Office are in the process of delivering a very successful webinar series around PPI in children and young people. The PPI Opportunities Database, where researchers can engage with public and patients interested in participating, and likewise public and patients who have ideas and want to participate in research can get connected up with researchers. And then finally, sharing of case studies. The network governance, I'm not going to go through in any great detail. It's still bedding in. Our PPI Ignite Network Steering Group has had its first meeting since our initiation in March. And we have already had some workshops with our partners to share our experiences and get a better feel for how we're going to work together. So finally, if you're interested in getting involved, I would encourage you to avail of the opportunities locally. Each of the local universities has a PPI Ignite network office with its own program manager. You can follow the network on Twitter, either through the National Programme Office or the individual university sites, or you can contact the National Programme Office Program Manager, Edel Murphy. Thank you very much, and I'd be happy to answer any questions.